Hello, this is Dr. Morris. I'm doing the review for the final exam. The final exam will cover the reproductive system. About 95% of the exam, if not a little bit more, will cover the reproductive system, and then the other 5% of the exam will be questions taken from material from throughout the semester. Your major focus should be on the reproductive system. The questions that I ask you from the semester will be very general questions that you should already have a good knowledge of and should be able to respond quite well to those questions. I'll start the review with the laboratory portion of the exam. Structures that I would potentially ask you to identify for this exam will include structures such as the urinary bladder and its position and its relationship with reproductive organs such as the prostate gland, the seminal vesicle, the urethra. There's a prostatic urethra that you should be able to identify. There is also the penile urethra, and then the external urethral meatus. Should be able to identify the testicle, should be able to identify the epididymis. You should be able to identify the ductus deferens. It's also an additional illustration that gives an anterior view of the male reproductive system. I would expect you to be able to identify the inguinal canal. I would expect you to be able to identify the cremaster muscle. I would expect you to be able to identify the scrotal septum and the raphe, which separates or partitions the two testicles. You should be able to again identify the testicle covered by a visceral layer referred to as the tunica vaginalis. Should be able to identify the epididymis. You should be able to identify the neurovascular bundle here, which includes the genitofemoral nerve, also includes the papiniform plexus or venous plexus, the testicular artery, the differential artery. All of this composes the neurovascular bundle that innervates the scrotum. You should also be able to identify the shaft of the penis and the glans penis. Again, I believe there's another photograph that will illustrate this a little better. As we look at deeper structures of the testicles, I would expect you to be able to identify the seminiferous tubules. Should be able to identify the rete testes. You should be able to identify the head of the epididymis, the body of the epididymis, and the tail of the epididymis as it develops and leads out into the ductus deferens. Should be able to identify this region as the spermatochord, which will include the ductus deferens and the blood vessels, the neurovascular bundle that innervates this area. Female reproductive system, you should be able to identify the central structure, the uterus. Should be able to identify the linings of the uterus, which are composed of the outermost layer, the perimetrium, a center layer, the myometrium, more of a muscular, thick muscular area, and then the endometrium lining. This makes up the uterus. Should be able to take this from the deepest layer to the most superficial layer in order. Should be able to identify the cervix, and I have another illustration that will illustrate this a little more clearly. Should be able to identify the relationship with the rectum, sits posterior to the uterus and posterior to the urinary bladder. As you can see, the urinary bladder sits a little inferior and anterior to the uterus. Notice the external urethra. Also note the opening of the vagina. Also be able to identify the clitoris, the labium minus and the labium majus. Again, I'll show you this on a different photograph in an anterior view. Should also be able to identify the ovary, the fimbriae, the uterine tube, the broad ligament. Again, I'll show you that on another illustration. This is an frontal view. Gives you a view of the cervix and the cervical os. Should be able to identify these structures. The vagina, the vaginal rugae. should be able to identify the broad ligament, should be able to identify the fallopian or the uterine tubes, should be able to identify the fimbriae, the infundibulum, should be able to identify the ovarian ligaments and its attachment from the ovary to the body of the uterus, should be able to identify the suspensory ligaments. Again, an anterior view of the external genitalia, should be able to identify the mons pubis, should be able to identify the glans clitoris. You should be able to identify the prepuce of the clitoris, should be able to identify the urethral opening, the vaginal entrance, the hymen, the labia majora. Breast tissue. Remember that the breast tissue is associated with the reproductive system, but the breast tissue, the mammary tissue itself, is a part of the integumentary system. Would expect you to identify the lactiferous ducts, should be able to identify the areola, the nipple. There are also suspensory ligaments located here, should be familiar with and be able to identify, in the lactiferous sinus. I placed this chart in as a portion of the laboratory exam, though learning this chart will very much help you answer several of the questions that are on the lecture portion of the exam. I do want you to appreciate the relationship of the hypothalamus, the hormone that is released here, gonadotrophin releasing hormone, the anterior pituitary gland, which demonstrated again by this illustration, where it produces or has a production and secretion of follicle stimulating hormone, also production and luteinizing hormone and secretion of luteinizing hormone, its effect on the ovaries and the development of the follicles, secretion of inhibin. As you know, inhibin works in a feedback mechanism to maintain homeostasis, will actually feed back and stop the production of follicle stimulating hormone when levels are adequate amount to produce estrogen, the hormone produced by the ovaries. Also, you'll see the secretion of progesterone by the corpus luteum, and again you see the feedback mechanism which will feed back to the hypothalamus and decrease the production of gonadotrophin releasing hormone. Should know basically the effects of the hormones that are released, such as estrogen, effect on the central nervous system, stimulation of bone and muscle growth, establishment and maintenance of female secondary sexual characteristics. Also, you see maintenance of accessory glands and organs and stimulation of endometrial growth and secretion. You also see progesterone plays a role in this as well. These are the steps of the development of the follicle: the primary oocyte, the development of the zona pellucidum, cells that will border the development of the primary oocyte, thecal cells, the nucleus of the cell, the granulosum cells, and the primary oocyte, as you can see, as it continues to develops into the tertiary follicle. This is the illustration similar to what I just showed in the female reproductive system and the male reproductive system. The hypothalamus and its release of gonadotrophin releasing hormone, anterior lobe of the pituitary gland where we'll see the secretion of luteinizing hormone, follicle stimulating hormone, its effect on the testicles, the interstitial cells of the testicles where we see the secretion of testosterone, and again the feedback mechanism to the hypothalamus because the levels of testosterone which actually will turn off or shut off the release of gonadotrophin releasing hormone. You also see the secretion of follicle stimulating hormone by the anterior pituitary gland, which affects the seminiferous tubules, the substenacular cells. We'll see androgen binding protein synthesized, stimulation of spermatogenesis and spermiogenesis. Also, you see the effect of the secretion of inhibin, which again by feedback mechanism will certainly go back to the anterior pituitary gland and shut off the secretion of follicle stimulating hormone, and may have an effect as well on the hypothalamus. These are the development of sperm, the spermatid, and the different parts of the sperm. You can basically review this slide. You should know the structural components of the spermatozoon, the nucleus, the chromosomal cap, centrioles, the mitochondrial spindles, requirement for energy. Remember their flagellum. The tail of the sperm requires a significant amount of energy. The mitochondrial spirals are important for providing that energy. I will now review the material that will be covered on the lecture portion of the exam. Again, final exam for the reproductive system. You should be able to identify the organs of the reproductive system, both the male and the female reproductive system. This would include the gonads, the accessory glands and ducts, the external genitalia. You should be able to identify those structures on both the male and the female reproductive system. You should know the role and the function of the spermatochord and what is contained in the spermatochord. You should know what is meant by the development of and the descent of the testicles, their original location in embryonic development, the position of the testicles at the time of delivery. You should know the layers that cover the testes, including the tunica vaginalis, the tunica albuginea. Should be familiar with those tissue coverings and where their location is in relationship on the testicles. You should know where sperm production takes place. You should know the functions of the epididymis, function of the ductus deferens, the function of the seminiferous tubules, you should know the location of the straight tubules. You should know what is meant by ciliary action in the ductus deferens, ciliary action in the ductus deferens and what that relates to. You should know the importance of the accessory glands, such as the prostate gland, the bulbourethral gland, and the seminal vesicles, what their role and function are. You should be familiar with the normal findings in a semen analysis, what the normal volume should be, what the normal sperm count should be, what percentage of cells should be actively motile, what percentage of cells should have normal morphology. You should know the structure raphe, R-A-P-H-E, and where that structure is located at and why it's important. You should know the prepuce, where it's located at, the glans, penis, where that's located at anatomically. You should know what the erectile tissue that surrounds the urethra is called. You should be familiar with the anatomy of the uterus, including the body of the uterus and the cervix, the location of the cervix in relationship to the uterus and in relationship to the vagina. You should know the layers of the uterus. I think I reviewed that already in the lab portion of the exam, but the myometrium, the perimetrium, the endometrium. You should know the layers of the uterus, which one is the muscular layer, which is the innermost, which is the most superficial layer. You should be familiar with the organs that produce gametes and hormones. Basically, this is the gonads in both reproductive systems, both in the male and female reproductive systems. But you need to be familiar with the gonads in each system and specifically what their functions are. You need to know what the function of the epididymis in the male reproductive system. You need to be able to trace a sperm as it travels through the urethra. Begin at the vas deferens and follow it through each of the portions of the urethra out of the external urinary meatus. You should know the external genitalia in the male system and the external genitalia in the female system. And again, I think I already asked you to be familiar with the erectile tissue in the male penis. You should know the roles of each of the accessory glands in the male reproductive system: the seminal vesicles, the prostate gland, the bulbourethral gland. You need to know what the function of the uterus is in the female reproductive system. Anatomically, you need to be able to describe the uterus, its parts, the cervix, the isthmus, the body. You need to be able to identify which portion of the uterus is most superior, which portion is most inferior. You need to know the role of the parasympathetic and the sympathetic systems in the reproductive system. We talk about erectile tissue, whether that's the clitoris or whether that's the male penis, in relationship to parasympathetic activation and sympathetic deactivation and what occurs when this process takes place. You need to know the reproductive function of the vagina. You need to know the term peristalsis and why that's important in the reproductive system. You need to know the components of the spermatochord in the male reproductive system. You need to know the function of the prostate gland. You need to know the term and definition of ejaculation and emission. You need to know the roles of the ovaries and the uterine tubes or the fallopian tubes. You need to be familiar anatomically with the different ligaments in the female reproductive system: the broad ligament, the suspensory ligament, the ovarian ligament, where they're located at, what they support. You need to be familiar with the seminal vesicles, what the importance of the seminal vesicles are. You need to know what the nutrient source is for the sperm or developing sperm. You need to know the external genitalia of the female reproductive system, which would include the mons pubis, the labia majora, labia minus. You need to know what the term impotence means, impotence. You need to know what the term cryptorchism is. You need to know what the procedure orchiectomy relates to. You need to know the bit of information about ovarian cancer. We talked about in class. It's on the media presentation, also on the PowerPoint presentations. Why ovarian cancer is seldom diagnosed in its early stages rather. You need to know the definition of vaginitis and what some of the causes of vaginitis are. You need to know what pelvic inflammatory disease is. You need to know the relationship between pelvic inflammatory disease and infertility in females. You need to know what's meant by the term normal flora or resident bacteria and its importance in the vagina. You need to be familiar with the mammary glands, why they're important in pregnancy, and why they're important after birth in supporting the newborn. You need to recognize the importance of the test PSA, prostatic specific antigen. You need to recognize the importance of performing a digital examination in the male to evaluate the prostate gland. This will cover the information that will be on the exam. Good luck.